Okay, so I will read a short CV about Dr. Associate Professor Dr. Nofatlina. She is a consultant nephrologist and senior lecturer in internal medicine at UPM, and also a deputy director clinical at Hospital Sultan Abdul Aziz Shah. As National Program Coordinator for the National Postgraduate Medical Curriculum in Internal Medicine, she will offer valuable insights into internal medicine training and nephrology as a subspecialty. Okay, so our second speaker is Prof. Dr. Kuan Jiu Win. Okay, Prof is a clinical hematologist at University Malaysia Sarawak. With her long-standing background in Ministry of Health Clinical Service, her work now encompasses academia and research. As program coordinator for the coming Masters in Internal Medicine at UNIMAS, she will highlight clinical hematology as a career pathway. And our third speaker is Professor Dr. Yang Faridah, who is a consultant radiologist at University Malaya and UMMC and past Deputy Dean of Undergraduate. She established cardiac imaging services and served in the College of Radiology, Malaysian Medical Council and Education Committee of ASEAN Oceanian Society of Radiology. So as a lifelong learner with a Master of Medical Education, she will share her perspective in radiology training. Okay, so before we start, I would like to inform everyone that the presenter will present for about 20 minutes each. And then at the end of all presentation, we are going to have a question and answer session. Okay, so for the attendees, during the talk, please mute your mics and off your videos. I think this will automatically be set by the organizers, but however, during the question and answer session, you can unmute if you want to ask directly, or you can always drop your questions in the chat box and I will read them at the end of all presentation. I think that would be all. And without further ado, I would like to call upon Associate Professor Dr. Fadlina to start her presentation. Please welcome.
Assalamualaikum warahmatullahi wabarakatuh. Very good morning. Thank you, Prof. Suhaila, for your kind introduction. So let me share my slides. I was approached by the team to actually talk a lot more on internal medicine and just a little bit on my part as nephrologist. So just for some sort of have been said by the chairperson just now. I actually been a lecturer for a very long time, and now being a national coordinator for internal medicine for postgraduate medical curriculum, and I also am the writer for the chapter of internal medicine, and it has been done already being executed recently 2021. So the next week of internal medicine, as I know that most of the listeners are those who are looking for career pathways, we are already using this national postgraduate medical curriculum of internal medicine. So I have interest in public education, particularly with diseases, mainly dialysis and renal palliative. And now I'm doing some admin work as a deputy director. I also have social activities, community, which is an admin of my Buah Pinggang. So it's all related because this is all part of a career pathways. Yeah. Right. So everyone knows what is internal medicine. It's in broad nutshell, we are actually to be a medical detective. We comprise all the signs and symptoms, relate a diagnosis so that we can have a proper treatment and care plan. So whoever willing or enjoy becoming some sort of detective, the physician pathway is the way to go. So we know a renowned physician, a Canadian guy named William Osler, who have been giving a lot of quote. Medicine is a sign of uncertainty and art of probability, because you always look around and from top to toe, from head to the all orders to find a diagnosis which is suitable so that we can give a better care plan for patients. We focuses mainly on chronic, acute disease processes, and at the end of the time, we have a wide range of practice environments. We can have urgent care environment, chronic care environment, and most of the time we were in the hospitals, but occasionally we do have clinics and community clinics outside in communities, but in the hospital we mainly do all the clinics and wards activities. We have diverse to be a physician, or we can also call it as general internist. We love to have long-term doctor-patient relationship. Some subspecialties to follow up the patient from the time of diagnosis until they die. For example, hematologists, yeah. And we also be always the focus on the front line of medicine. If you remember, during COVID time, all the physician has to come forward first, yeah. And we also be sort of people who trust to act as a head coach of coordinator of certain care, and have variety of disease entities. As we know, doctors mean teachers too. So these are just to show you some pictures of William Osler, who attending a patient in 90s, yeah, 1900. So he actually bring all the nurses, medical students to do teaching and whatnot. So this is usually what the physician will do. Hence, of all the things that I've said, the physician pathway are the most career choice offers for the undergraduate or the MOs, people who look for career, what to next. It is flexible, the fastest ways, and has the most number of subspecialty choices and longest workability duration. Of now, internal medicine is also the largest medical subspecialty in Malaysia. We have 2,000 specialists from general internal medicine to all the specialties that we have, and including the MMed and Para pathways, we already had about 800 trainings, yeah. So this just to show you, NPMC do have a curriculum internal medicine, and as we know, NPMC wanted to make sure that all doctors are trained to the highest standard, that ensuring patient safety, quality of care. And in Malaysia, we have two pathways to become internal medicine specialist or physician. You can either choose the public university pathway, which is MMed, or a parallel pathway that we call it MRCP. Okay. In MMed pathway, the candidate will take Master of Internal Medicine in any of these universities, and they have to go for 4 years training minimum. And in parallel pathways, however, previously people go and get exam part 1, part 2 and paces within no stipulated time. But during the mapping of both pathways are going to be similar. Okay, just a quick one on entry requirement of how to go into both paths. Of course, you must have your basic qualification, MBBS on. You must fulfill your houseman requirement 2 years mandatory. You must have your basic life support. And for MMed, you must take NEX, or we call it internal medicine entrance examination, where you must pass to band 4 to be admitted to the program. However, if you have MRCP part 1, you can be also a candidate for MMed pathways. Yeah, for para pathways, you have to have your part 1. You have to attempt your part 1 to go through to part 2 and also paces. Right, so this I'm going to spend a bit of time on this chart. Yeah, so this chart just to show you how both pathways are actually mirroring each other. So whether you MO pathway, which is the ACT program, or you want to take the MOH pathway, which is a parallel program, both are now combined into one curriculum of NPMC internal medicine. So basically, they will share the same assessment. They will do 4 years rotational, going through all the subspecialties. We have an exit committee review. We have a big summative exam, and after that, we go to the same amount as gazettement. So in total, it has to be 4 years minimum. Right, what we're trying to achieve with this NPMC, of course, we want to make sure that internal medicine share one curriculum for the whole postgraduate training of internal medicine. So core curriculum will covers all basic aspect of subspecialty internal medicine. And even though they have a different exam, but the standard will be the same for assessment and for everything else such as training portfolio. Okay? And they can sit for both exams if they are capable. All the trainees of internal medicine will do similar thing all over in accredited centers across the country, and will be overseen by all these one kuasa or committees. Just a quick view on what will life of internal medicine trainees are. So basically, in any other subspecialty also, we are doing almost similar thing. However, of course, as we are focusing on acute and chronic disease process, so we do have a lot more things to do, like referral emergency departments and ward round on call and so on and so forth. We have a robust and comprehensive syllabus so that we can improve our think tank here to think of all the diagnoses possible. And these are the specialties that we have. I'm a nephrologist, so it's actually one of the major or bigger part of internal medicine. All the one bowl are the very important, more than 3 months rotation if you are in the syllabus, and the smaller one unbowl are very important topics. However, you can have a minimum of 1 month rotation in the syllabus. We also emphasize on all the core knowledge of the diseases by improving all the root cause, which is epidemiology, immunology, and the rest that you've seen in the cartoons. So I just mentioned the bigger, or we call major rotation last time, but we don't call major anymore because everything specialties are major to us. But this 6 rotation, they must go to 3 months rotation in NPMC, and for the other, right here, it's just minimum of 1 month, but you can have it more if you want. So just to show you some guide for applicants, if you are interested in the future to actually join us as an internal medicine specialist. A quick picture of how I am. Last time I was a bit small, teen, during my gazettement time in HKL, where I'm the only physician gazetted, seeing all 90 cases. But it's very interesting, very fun. And if you see at this picture, 3 of us are already nephrologists here, and here, and Shanas is a hematologist. Okay, so we are still having a very good time together. Okay, why nephrology? Now I'm going to very quick one. Why I choose nephrology? I would like to quote what Homer W. Smith said. Bones can break, muscle can atrophy, glands can loaf. Even the brain go to sleep without immediately endangering our survival. But should the kidney fail, neither bone, muscle, gland, or brain could carry on. So this is a very important quotes here, showing that kidneys are the most important organ in the body. And I would like to challenge myself always, hence actually join and become a nephrology. Just to show you evidence-based, this study has been done by a Renal Fellow Network and published in July 2010. Why people choose nephrology as the subspecialty? Most of us who choose because we are crazy people. We like to challenging diagnosis. We want to think of so many things and come up with the disease diagnosis. And the most important thing is like to do procedures. We have renal biopsy, we can do catheter insertion. I went to OT as well to do cough insertion, and it's very challenging because we can see patient come back to normal with a lot of treatment that we can give. And we have a very good relationship with patients as we follow them up until they die. If we cannot do anything for them, such as in end-stage kidney disease. So I like to do puzzles, and being a nephrologist is part of what I love most in my life. As I said, it's intellectually stimulating. Every day is a different ball game. I have a meaningful doctor-patient connection. And of course, it's a very rewarding nephrology careers. You can also do a lot of private practice when you are a nephrologist. I think like my first slide is just to show why nephrology is very important, because what you see now is just the tip of the iceberg of what the real kidney disease are. Yeah. So we need more nephrologists in the future for us to help and combat this disease, because the cost of treatment are very high in the patient's population of kidney disease. These are some of the pictures where I went to OT. I'm not telling bullshit or what. Really, I went to OT. I do a type of insertion peritoneal scope, and I also do it in procedure room, the bedside procedures. And these are my teams in University Putra Malaysia. We have what we call as Nephro UPM to help the community to serve the better care for patients with kidney disease. I think this is my last, so 20 minutes, hopefully. So I'm back to you. I'm just one word: take care of your kidneys and they will take care of you. Back to you, Priscilla.
Okay, thank you, Associate Professor Dr. Fadrina. It is actually less than 20 minutes. Okay, so that's good, because I think we can proceed with the next speaker, and we have more time for question and answer. And for the participants, please don't forget to sign in your attendance in the link that is provided in the chat box. Yeah. Okay, so please welcome Prof. Dr. Kwan. You may start now.
Good morning, everyone. Can you all hear me? Okay. So, I would like to continue with the second lecture in this morning, whereby on exploring careers in clinical hematology. Dr. Fadlina had encouraged everyone to go and check out on nephrology, saying that if kidney fell during sleep, then everything will gone. But that is the same for blood. The blood have to function 24 hours. Okay. So with this lecture, I would like to impress all of you that maybe you all can consider taking out hematology as your career, because it is also very, very interesting. Okay. So, but before I go more into hematology, I would like to clear some possible confusion about hematology or hematologist. Okay, so in hematology, nowadays you can divide the hematology into clinical part or the laboratory part. So the clinical part will be what we call a clinical hematologist, or in short, so that is not that mouthful, then we will say you are a hematologist. But if you are mainly laboratory based, that means that you are trained mainly in pathology, then you specialize in the hematological condition. So you are actually a hematopathologist. This distinction or division only more apparent for the last roughly about like 20 years in Malaysia. For the last previously in 30 or 40 years ago in Malaysia, this distinction or this division is not that apparent because at that time that there are not many hematologists or hematopathologists around. So almost all the clinical hematologists, actually they are also specialized in laboratory side. So if you trace back the history, the hematology, actually to be a hematologist, you have to be well versed in both clinical and laboratory. But nowadays, because of the division of the work in Malaysia, the pathway difference, so now clinical hematologist is mainly like in clinical, seeing patient. Definitely they will see patient, but they will need to have a good skill upon the laboratory test too. But for the hematopathologists, they are mainly stationed in the lab, and they will run all the related hematological related laboratory tests. For example, they will look at the bone marrow slide, the tryptophan slide. They will also can run other specific hematology tests like immunophenotyping, etc., etc. Okay, so for this lecture, I will mainly focus on the clinical hematology side because I'm a clinical hematologist. So why want to be a hematologist? Okay, I think every people will be different. But for me, why I choose to become a hematologist is because I get happiness. I feel very sort of like open up to you, then you will know you will know their life. Okay, for example, then you will know they are sad. They are more sad than now compared to the last admission, things like that. Then when you talk to them, they will tell you something that you might not know if you are other specialty. I feel okay, like sometimes the patient will tell me my husband divorced me because after I got this hematological cancer. Then sometimes they will tell me sorts of other things like that. So it is over the time, it sort of like form a very strong bond between me. And then when I get very happy when when they get better under my care. Like for example, I just recently saw a 14-year-old boy with Hodgkin lymphoma, very, very huge mediastinal Hodgkin lymphoma until when you open up the shirt and you look at the chest wall, you can see the chest wall is like abnormal because there is something underneath the chest wall that push the chest wall up, and the chest wall is like bulging out like that. But the tumor is not so advanced until it penetrates the chest wall yet. Then there is a superior vena cava obstruction, and the patient's face is swollen because the blood flow go back to the heart is obstructed, things like that. So then during the first cycle, he was so moody, 14-year-old boy, very moody, very quiet. Then after one cycle of the chemo, I just saw him 2 days ago. He become much better. I can see the light. I can see the light in his eyes again compared to the first time. And then he even asked me, doctor, can I take chocolate? Because the patient that on chemo, they have to be abstain from certain food pantang. So Then he would start asking me a question like, can I eat chocolate? Can I eat Coca-Cola? Things like that, with a smile on his face. Then I feel very, very happy seeing all these patients. So of course, it is very rewarding. But when you become a hematologist, you see all these very, very happy story, but you also see sad story, because we can't cure every patient. We can't cure every hematology cancer. So seeing the patient going off, passing away, it makes you feel very strange, and over the time, it makes you feel, looking back at your own life, what you want in your life, what is important in your life. So that's, for me, why I want to become a hematologist. And maybe different people will be different. Of course, later I will touch on the other prospect, like your income, your quality of life, things like that. So, okay. So now I will go a bit further, okay? So the career pathway to hematology in Malaysia. So Dr. Fatlina had just now mentioned about the internal medicine. You have to become an internal medicine specialist first, okay, before you can become a hematologist. Okay, so I think Dr. Fatlina had explained this, okay, in a very concise manner, whereby you got two pathway, MRCP versus the Master in Internal Medicine pathway. Then after you get that, then only you can go into the hematology subspecialty training, and it will be a clinical training, okay? And I will elaborate more in the next slide. So what happened for the clinical training of hematologists in Malaysia? So you have two training sites. You can be trained in Ministry of Health, I mean the hospital in Ministry of Health, or the hospital in Ministry of Higher Education. So for the Ministry of Health, you can be trained in any MOH hospital with hematological service. The Central National Center for the Hematology is in Ampang Hospital for MOH. For the MOHE, you can have your training under MOHE too. You can have it in University Malaya. You can have it in UKM. Okay, and I think these are the two hospitals that you can have your full hematology training there, because they have a transplant service. The training period will be minimum of 3 years. 3 years. Okay. So if you are training under MOH, which I was, okay. So your first year, that's all, you have your first year, second year, and the third year. So your first year can be in so-called peripheral. So that means that not Ampang Hospital, because Ampang Hospital is the national center for the hematology training. So you can be like in Sarawak General Hospital, JB Hospital, Penang Hospital. Okay, even in Sabah Hospital, you can have the training in the peripheral hospital like that for 1 year. Then the second and the third year, you have to be sort of like in the national center, which is the Ampang Hospital. During your third year, you can choose to be proceed with your posting in the overseas, or you still remain in the center. So within these 3 years, you will need to undergo not only the clinical training that will be exposed to clinical seeing patient every day clinically, okay, involving A&E, daycare, clinic, and also ward. You also will need to undergo a laboratory posting. That means that you are fully in the lab. You look at the bone marrow slide, triphyline slide, you read the PDF, you try to understand and try to read how the immunophenotyping will be, cytogenetic, blah, 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 things like that. You also need to have at least 3 months of posting in the transplant ward, so that you are exposed to what happened in the transplant, what is the procedure, complication, or how to manage the patient. Within these 3 years, you also got some sort of like peripheral attachment. You need to go through a short posting, for example, in blood bank. If you are training in Ambang Hospital, then you will get the attachment to Pusat Darah Negara. You need to go to oncology or RTU unit, the radiotherapy unit, to know how the things are, because to treat hematology cancer, you need to acquire one of the modalities of treatment for most hematology cancer involve radiotherapy. So you need to know how radiotherapy work, the principle, and how the setting will be, because we will send our hemato patient to the RTU unit to undergo the radiotherapy. You also need to know how to take care of patient when you can't do anything more, or the patient go into the palliative care. So you need to have attachment in the palliative unit. You will need to have attachment in nuclear medicine unit too, because PET CT scan is one of the very important imaging modality in hematological cancer. You will need to have some attachment in IMR Institute of Medical Research in KL, whereby you learn on all the sophisticated laboratory tests like HLA, human leukocyte antigen. You learn about the PCR. You learn about cytogenetic phage or other important hematological tests like DNA analysis for the beta and alpha thalassemia, blah, 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 things like that. So this will be what happened in the training period, minimum 3 years. And nowadays, with the more and more number of trainees, you will need to wait for your queue to undergo all these posting attachment to complete your training. So before you start your training, you will need to register as a trainee. Okay, how do you register? You need to fill out a form. Of course, your trainer will know that you want to take out hematology already, because you need to approach them and express your interest to be trained in hematology. They will already know you, and if they agree to take you in, okay, then you need to register as a trainee, okay, and the form of the registration is available in Malaysia MSH, the Malaysia Society of Hematology website. You need to fill in the registration form and submit. And once it is approved and also approved to be, you are approved as a trainee, you are successful registration, and you got your attachment approved by the KKM, the MOH or the MOH side, then only then you start the clinical posting and the clinical training. So you have to fill in the logbook. There is a syllabus for what you need to learn, acquire the basic minimal knowledge as a hematologist. So during that 3 years, you have to fill in logbook of the procedure you have done that is related, like for example, bone marrow, intrathecal, etc., etc. Then you need to sit for exam. So the exam will composed of part 1 exam and part 2 exam. Part 2 exam is also so-called the exit exam. So the part 1 exam, the earliest time that you can take it is after your first year of training, okay, which will consist of 50 MCQ and 5 SAQ. Your part 2 exam will be after you completed your 3 years training, at least 3 years of training, whereby there will be 4 stations, 4 viva station, which it will compose of Medlinen, 1 station, benign 1 station, morphology 1 station, coagulation and transfusion 1 station. So that will be sort of like the overall of the hematological training. So if you fail the exit exam, then you can retake. So there will be two exams, 2 times per year. 2 times per year. So if you fail, then you can receive again. And there is no limit of the number of attempts for you. Okay, so just now I share my experience why I want to become a hematologist, but I think you all might be interested to know other aspects which I think might be important for some of you. You might want to know whether you will be earning enough money to support your family. How about hematologists, and what kind of job that you are doing, which I sort of like more or less like sort of like covered just now. Okay, so in order to elaborate on that, first of all, maybe I think age is very important. Okay, so when you completed your house officer, you are roughly about like 26 years old, or 27 years old. Okay, so after you finish your internal medicine specialist, you finish everything in time, everything back without any delay. The youngest I think you can get through that will be roughly about 29 years old. Okay, and if without delay you go into hematology, I think you can complete everything. You can complete everything by the age of 34 years old. At the age of 34 years old, then only you finish everything. For me, right? Then we go back to previous about like family. If you want to have children, if you want to have kids, 34, 35 years old is already like going into elderly, not elderly, pregnancy age that with higher risk. So it is difficult. That I think there is no way that you get easy on that. Okay. And when I was in hematology, I have think very hard about this. Whether I want to finish all these things, then only I start to have my child. I married very early. I married before I was a house officer. So I married at the time of graduate so that both of us can pause at my husband is also a doctor. So that we pause at the same place. So we don't have any children because we want to pursue of all the specialty. So at the time when I become a hematologist, I train during training, I think very, very hard that whether I want to have my children after that or what do I want? So at the end, I decide that no, I don't want to have a high risk pregnancy after 34 years old. So I got pregnant. I got pregnant during that time when I'm under hematology training, and then I pregnant and I do my training, and believe me, it is very, very difficult. And I was postpartum about 1 to 2 weeks when I sit for my exit exam. I really had a hell of life during about that time, but I pulled through, and I'm very glad that I made that decision. Although I was having a hell of life for about like 5 years during that time, I pulled through. I feel very happy for myself. Okay, and for those who wants to go into hematology, I think I should say hematology because I think all such specialty in internal medicine will be roughly about that kind of age range. So I think you all need to, especially lady, I think you all really need to plan what you want for your family and how you want to do for that. For the money, I think your income, you will definitely be T20 lah. Okay, you definitely get into T20. Okay, when you become a hematologist. Okay, so don't worry too much unless you really want to save a lot of money to send your child overseas lah. But if your child is studying in Malaysia, I don't think there is a lot of problem. And as a doctor, if you're busy with your clinical life and things like that, right? I feel that I will not spend, most of us will not spend too much lah. Because then we will have a lot of saving actually. So by the time that are already in the internal medicine specialist, if you already start from square one, I mean, you don't have a lot of property from to start with. By that time, during your internal medicine specialist, you will have your first house already, and you are paying house loan, things like that, and you will be able to sustain. There's no problem at all. Okay. So then for after that, then maybe I just had one slide of what after that? What after hematologists? What is await after that? So there are some of us, some of our hematologists in Malaysia, they go and double specialize. So they go and take the degree and also the certification, so they become clinical hematologists and clinical pathologists, hematopathologist. So they got double degree. Okay, or you can go and subspecialize. After you become a hematologist, you subspecialize some more. You subspecialize in transplant. You subspecialize in malignant hematology. You subspecialize in benign, or you subspecialize in coagulation and transfusion, things like that. Okay, you can do that. Okay, or you can become more into research. You become a researcher, or you become an academician. Okay, you go into you join university, you become a lecturer, so that then you teach. Or what's next? Or you can even if you want, you can pursue to your PhD. Like me, I pursue my PhD, and I got my PhD before the age of 45. I bear in mind that most university nowadays, right, the cut-off age limit for you to pursue a PhD is 45 and below. So if you decided you want to take PhD, right, you better decide earlier. And what other paths that you want? I always think there is always other paths for us. Like for example, so you can always go into other career. If you do not want to see patient, you want to go further, then maybe you can join the pharma company or things like that. Okay, so there are always other paths for you. Okay. So in summary, in Malaysia, so for you to become a hematologist, you need to go through internal medicine specialist, or you become a general physician first. So the training of hematology is structured in Malaysia with exit exam. The age at completion of training is about, like, if everything without delay, is about 34 years old. And the career path after becoming a hematologist can be very diverse. Okay, it's really up to you what you want in your life. Okay, with this, I end my talk, and I'm happy to get any to receive any questions after that. Thank you very much.
Okay, thank you, Prof. Kwan. It's a very interesting journey that you share with us, especially the advice on when to get married. Okay, and plan for your children. Okay, so now we will proceed with the third speaker, which is Prof. Dr. Yang Farida from University Malaya. Please proceed, Prof.
Thank you. Thank you so much, Zaila, and thank you, Memes, for allowing me to share my my presentation. Can you see it? And is it in full view?
Yes.
Yes, okay. So I've entitled this Radiology Secrets, Career Pathway to Specialist Qualification. But what I will be telling you are not really secrets, because a lot of the things have been shared with there are similarities with the first two speakers. But it is a secret in a way, because these are things that I feel is important for you to know should you choose a career in radiology. So, overview of my talk, I'll be talking about who we are, what we are trained to do, why you would choose radiology as a career, when, how, and where to receive training. And I want to take a little bit of time to talk about specialty qualification beyond and entry into NSR. And I will end with just conclude and talk a bit on skills of a radiologist once you have graduated. Now, because the people who this presentation is targeting to is a wide range, there will be parts that you feel may not be related to you, but I've tried to make sure that all who participate, from medical students to medical officers to even lecturers, so on and so forth, will be able to get something out of this, as how the other speakers have done. So I want to talk about the background of radiology per se. Radiologists were first introduced actually to Malay Peninsula in February 1897. Note, it was just less than 2 years after discovery of X-ray in December 1895. So we were very early, and this started with an X-ray machine that was installed in Taiping Hospital, Perak. And the first image was actually an ikan bawal, so there was no issue of radiation there. Yeah, early radiologists, there were two, both from United Kingdom, and they were serving a population of 1 to 660,000 populace at that time. So we first started with training of radiographers and radiotherapists in 1963 and 69, but it was not until 1983 that we felt that a local program needs to be able to help train and produce radiologists for the country. And it started with the Masters of Radiology program at UKM. And since then, oddly, about around 37 years, this country has been producing radiologists for the nation. And now we have about 870 registered radiologists in Malaysia, serving 33.57 million, which is a ratio of 3.9 per 100,000. This is still less than major countries such as Singapore, UK, and Europe. Yeah, so we still need more and more radiologists. Who are we? We are basically medical doctors with a specialist degree, and we are known as radiologists. Basically, our job is to interpret images for the purpose of diagnosis, screening, prognosis, therapy. And there are two main branches, mainly diagnostic radiologists and interventional radiologists. Basically, we are the doctors or the specialists that have said, we're not going to use a stethoscope. There's no point trying to hear and make a diagnosis. Let's bring on the high-end machine and basically just look directly into the patient to see what's happening. Okay, so that's who we are. So when you are trained, you're going to be trained in be able to interpret and use multiple different types of imaging. Some of them use radiation, ionizing radiation. Some of them do not. But you basically, these are some of the imaging modalities that you will be exposed to. Yeah, and in our training, you have to know radiological anatomy. You have to know medical physics, and this is an important aspect of radiation protection. Yeah, and the word ALARA is actually as low as reasonably achievable. So whenever we do any imaging using ionizing radiation, we just want to give enough radiation for us to be able to diagnose and have a diagnostic image. We do not want to give more. More radiation may give better image, but as long as you can diagnose, you should stop there. So this is an important aspect of radiation protection. You also have to know about radiological procedures as well as the differential diagnosis of the images, of the findings that you obtain from the images. Yeah. So in an essence, a simple way to look at this, as a diagnostic radiologist, all radiologists are diagnostic radiologists. Let just me put it there. So let's say you have a 52-year-old patient with coughing, loss of appetite, loss of weight for the last 3 months. You already think, I'm going to have, a bunch of differential diagnoses, but then you decide I need a chest x-ray because patient is coughing. And with the chest x-ray, the radiologist, the diagnostic radiologist will report and interpret and say, yes, there is a mass in the left upper lobe, and this is likely to be, and they'll give a bunch of differential diagnoses, and one of them is going to be carcinoma, of course. Then comes the interventional radiologist. Now, this is the branch of radiology in which you do intervention with image guidance. So the same patient, you can image guide and get a biopsy, and with the tissue biopsy, you're going to get the diagnosis. And for example, this is going to be carcinoma of the lungs. Yeah. So that's the way the different branches of radiology stands. So as I mentioned, interventional radiologists, you can get it they can be a general interventional radiologist or do it in breast, musculoskeletal, or respiratory. These are the superstars of radiology. All trainees coming into radiology, they all want to be interventional radiologists, but not everybody can make the cut. But basically, you do non-invasive procedures and therapy, and they get more money, of course, and they're the superstars. So for example, a patient stroke, you can see the red area of hypoperfusion, and the MRA of the patient actually shows stenosis of a vessel. The interventional radiologist can go into the vessel, remove the clot, and actually improve the perfusion of the brain. Yeah, so these are cutting edge things that we are doing in Malaysia. The interventional radiologists are doing in Malaysia. So I want to talk a little bit personally on why I chose medicine. Now, with everyone, when you are choosing something, it's going to be a combination of factors that make you choose something. It is, most of them are going to be external factors, external motivators, they call it, yeah. But what is important is by the time you want to choose those external motivators, you need to, converge it to be internal motivators. You need to do it for yourself and not for anything else. So there are three things, I think, when you want to choose something that is very important. And this, if you can see the other two speakers. So first one I've talked about, moving your external factors to internal motivation. Second factor, and I think the two speakers before me shows that very well, passion. You must have some passion from the start and later on really be passionate in what you do. And the third one, even if you have these two, you need to have a little bit of leap of faith. There must be a bit of leap of faith. So if you want to choose anything, make sure you remember this, if it's of any help. Me personally, at 14 years old, I decided I was going to do medicine because of a TV program, just like many 14 years old. Okay, there was a TV program called Quincy ME. Now, this person is a doctor. He's, noble. Wow, fantastic. He's a coroner, gruesome, but wow, he's able to know accident, this, that, and he solved mystery. How cool. So I, at 14, not just decide to be a doctor, I decided to be a pathologist. Okay, that was how fixed I was. All these are external factors. In the end, why did I choose radiology? Because your life lessons and life experiences is going to tell you. So there was a lot of exclusion as I shift. I knew I was not going to be a coroner even as a medical student because I realized, oh no, this is not the life for me, okay? And this is where my external motivation started to become internal because I had high respect for the radiologists when I was doing housemanship. I trained in General Hospital at that time, Hospital Kuala Lumpur, and there was so many things we didn't know in the ward. And when I go to the radiologists and they are able to solve and diagnose. And I had such respect. I felt they were so clever. And therefore, it became internal for me. And I still get to solve mysteries. How cool, yeah? So in a way, why you would choose, like you as a person would choose radiology as a career, apart from making sure you have the internal motivation for it, have the passion for it, have a little bit of leap of faith. But if you as a person is an analytical thinker, you like to make lists, you like mystery or detective novels, you like solving games, because basically radiology is a piece of a puzzle that you put together, yeah? If let's say you're a visual learner and in the personality, you're a combination of introvert and extrovert, then maybe you want to think of radiology. And if you as a doctor, you like general medicine because basically radiology training is going to cover all medical specialties. And I really mean it. From the top of your head to the face, to maxillofacial, to the tip of your big toe, everything, yeah? If you have an affinity to anatomy, physiology, and pathology, not in a pedantic way, but in a fun way, if you have an affinity to technology, including AI, if you want to impact patients' management, but more in a team approach, yeah, and if you actually like to shape and expand understand that specialty, radiology would be for you, because radiology is so fast evolving. It allows creativity with their new technologies, new approaches, so on and so forth. So if all these things call to you, I think you need to take a look at radiology. And what about money? I think just now Juwin have mentioned about this. So I've made research on this. So this, don't quote me, but this is what has been put, that roughly you get about, as high as 27,300. And I think that's quite correct. If you are in government, being MOH or MOHE at the lower, higher end. But remember, with radiology, you can do local, and that can increase your earning depending on the workload at the time. And extra special radiology, there's this thing called teleradiology, which you can actually report something that's happening in India, in Malaysia, for example. So if you get into it, or something that's happening in Johor, you report it in Kuala Lumpur, for example. So this aspect of radiology actually is a money earning point, that I want to put. And if you go to private, radiology is seen as one of the medical specialties with the biggest potential, then your earning can actually be pretty high. So if you are now super interested, if I have managed to sell radiology to you, I'm going to go to how to obtain training. And just like the rest, there are two ways, but not the same as the two speakers. Radiology is a general specialty. Subspecialty is there, and they are known as areas of interest. We don't really have like subspecialty because the country still needs general radiologists. Yeah, so we train you to be a general radiologist. So two pathway: Master of Radiology or overseas program, for example, Fellowship of a Royal College, and you can apply as trainee from Ministry of Health, and you can either be permanent or contract, and you can go to this website, ehlp.moh.gov.my, to look at all the criteria that you need, or you can apply through the university as a scheme latihan academic, or you can apply as a private candidate. Yeah. How to obtain training? I'm not going to talk about the fellowship. I'm just going to talk about what I know, which is the master's program. And I'm going to talk about the entry criteria, the different phases of the application, as well as I'm going to take a little bit of time to just talk about what you do once you have qualified. Yeah. So this is my secret, basically. And I think Prof. Adwina has already shown this book. Please just type. There are many applicant guides from the National Postgraduate Curriculum that has important information of the of the specialty that you want to go into. So please take a look at this. I think the people who wrote, like Prof. Adwina, has worked so hard, and there's so much information. And this is the open secret, that if anything you take out of our talks, go ahead and read this, find this, yeah, because like all other specialty, we want to make the entry criteria to be transparent, equitable, and a formal admission process. And all applicants in radiology has to show evidence. You have to show evidence of appropriate qualities, qualification, experience in academic, in professional, and personal, meaning we want to see that you have attitude, values, and personal qualities suitable for a career in radiology. So these are some snippet of the entry criteria. Some are mandatory, such as being registered with MNC, sitting for the pre-entrance exam. Some are desirable, such as having exams to show you have got a certificate in medical physics, for example, having posters, presentation, publication, so on and so forth. MEDEX is the entrance exam, pre-entrance exam that you have to take, and a College of Radiology actually do a preparatory course every year for this. So if you're interested, make sure you check that out. Now, once you've gone through MEDEX and fulfilled the proper band, you are going to be called, you'll be invited for a radiology entrance exam and interview consisting of OSCE, rapid film reporting. And the interview will be held by members of the Conjoint Board of Radiology, and they are assessing you based on whether you're a good communicator, there is a sense of integrity and responsibility, you're committed to continuous learning, and you're able to embrace new technologies. Yeah. So in a way, the application process, many will apply, they go through MEDEX, then you will be invited for the entrance exam and interview, then you will be admitted into a radiology master's training program. And every year, about 100 to 110 applicants will be successful coming into the program. Where will you be trained? In all these universities, and that will provide you with the qualification, and you will be sent to training centers, which are the teaching hospital, Ministry of Health hospitals, and the KPJ group hospitals. Yeah. So this is where you're going to be training. So the Masters of Radiology is basically a 4-year program with 3 phases of training. And all this you can get from the guidebook, yeah, the applicant guidebook, the open secret I was telling you about. But I do want to remind, regardless wherever you do training, when you are in training, remember to keep a portfolio, keep evidence of the program, keep evidence of training, keep evidence of other activities. And you need to ensure that you maintain good relationship, because we are never an island, because you need this for your multi-source feedback, and these are potential mentors. Your mentors can be potential referees for you. Okay? And so this has been touched upon by all our speakers. So 5 years of medical school, 2 years of housemanship, at least 1 year being a medical officer, you can then apply to be a medical officer in training for radiology for 4 years, and that will get you your specialty basically. You can choose to do subspecialty, that will be another 3 years, yeah, or 1 to 3 years of subspecialty training. Now I want to talk a little bit about NSR. Now, what do you need to enter? Now, some of you may feel, I don't even know what I want to do. Why do you want me to look into National Specialist Register? Why? Because I hope that all of you are going to be proactive and be the determining factor and the direction you choose to direct your own pathway and your own career. You need to take charge. So if you want to take charge of your career, you need to know the outcome that you want to get. So end point of all we're doing here is basically you want to be recognized and be admitted into the National Specialist Register. What do you need? You need to be fully registered. You need to have attended specialized training in that specialty in a recognized training institution. You need to hold a recognized specialist qualification. You need to be of good and fit character. And you need to have information documents to support your application to NSR. I want to draw your attention on 2 aspects to it that you yourself from now on need to take care of and be able to provide. One is attended specialized training in that specialty in a recognized training institution. Your training institution and the training program now must meet the MMC standards. Yeah. And what are MMC standards? There is now standards for specialty training. All training programs must show best practices such as competency-based training, outcome-based education, teaching you evidence-based medicine and decision-making, have entrustable professional activities, and have defined exit criteria. So when you want to choose your training, you must make sure your training program fulfills all this, yeah? The standards in Malaysia, because you wanna practice in Malaysia. So the standards in Malaysia is this, yeah. The second part to this is holds a recognized specialist qualification. Now in MMC there is a list of recognized postgraduate qualification. At present, for radiology, these are the recognized qualifications. These will change But all I'm saying is, once you are ready to train, make sure you know where to look for this information so that the training program that you choose will allow you to be registered as a specialist in this country. Yes. So as a radiological specialist, this is what you have to do on a daily basis. Lead, oversee, and troubleshoot all the examination, interpret examination, write reports on your findings and recommendation, conduct multidisciplinary team discussions, and this is very important. You have to train future radiologists, radiographers, doctors. You work with the medical physicists and radiographers to ensure safety to staff, patients, and public, and this radiation protection. You have to do on-call. And some of you may decide to do intervention procedures, and you may decide to do research as well. Now, the important thing is, if you manage this well and you have good teamwork, this specialty actually affords quite good work-life balance. Okay, so I hope I've managed to do a very good proposal for radiology for all of you. So as a radiologist, once you've been trained, you're going to have an analytical mind and have good observation skills. You're going to have good clinical knowledge across all specialties. You'll be able to work well in a team and manage others effectively. You should have excellent verbal and written communication skills and manual dexterity for interventional roles. And as I say, radiology is an ever-evolving specialty. There's going to be new technologies, AI, increasing patient load, increasing minimal invasive approaches, and teleradiology. So you're never going to be out of work. There is minimal gender bias, but remember, very competitive training opportunity. So if you are interested in radiology training, don't fulfill just the minimum. Make sure you have more than that. So start accumulating relevant experiences, skills, and evidence for successful entry. Thank you very much. I hope I'm just correct at 20 minutes. Thank you.
Okay, thank you, Prof. Yang, for that very interesting and excellent presentation. I think you have pitched radiology very well, especially with the monthly salary and also the good work-life balance. Okay, so now I open the webinar for question and answer because I have not seen any questions in the chat box. So I now invite participants to ask any questions that you may have. Anybody? Anyone like to ask anything? Or you wanted to introduce yourself? Who knows, these panels might be the interviewer when you wanted to apply for master later, so that they get to know you earlier. It's a good tactic, I would say.
Yeah.
Okay.
Yeah, because you need to position yourself even now, Yeah. That's very good point.
Yeah.
They are shy.
Yeah, they are shy.
Yeah, maybe we just talk about the work-life balance, because I think even for clinical hematology, you were saying there is in any of this specialty, during training, please don't expect work-life balance. Not during training. In any of your training, you can't, because you basically, we expect you to give 100% into this. But I think later, once you are specialist consultant and you move on, your time is more your own. You can arrange it, and it actually allows you to have a balance.
Yes, correct.
Yeah, and like Prof. Adlina, even in her free time, she does her advocacy work. So but that's her. To her, that's a very good balance, because now the work allows her time to do all this. So yeah.
Yep, totally agree. You just have to plan yourself properly from the very beginning. Prof. Suhaila is my undergraduate colleague. I actually married early, Kwan. I married at the end of year 4, even during my undergraduate years. I just ventured into Masters of Internal Medicine when I already had 3 kids. So then it was well planned. So I have no during my training because I've already had my families, and but of course you have to juggle between the mother and registrars and all those works. But trust me, is worth it.
I have allowed talking to some of the participants. So if you would like to ask, then now is the time. Okay, I'm allowing participants to talk. Please, this is your time. It's not it's not easy to get their time. Okay, I think we have one. Oh no, this is not a question, but Dr. Isrianti is saying thank you to all the panel speakers for the wonderful presentation. I wish my student would hear this and opportunity for us to get the recording of these sessions. I will ask the organizer for the recording if it can be shared later on, Dr. Isrianti. Okay,
Thank you.
welcome. Okay, anybody else want to ask anything? Okay, I have one question now from Akmal Harun, a medical student from UNIZA. May I know what I can prepare as medical student or houseman later to increase my chance to be accepted into the specialties? Okay,
Which specialties?
which specialty, Akmal? All specialties. Oh, I think
Oh,
you need
okay.
to.
Okay.
Okay.
Good choice, Akma. I think you want to keep your options open. Okay, that's very good. Anyone want to comment first, or maybe I just comment a little bit first?
Yeah, Prof. Wan, I think you start first.
Okay, so I think during the medical student time, you let yourself open to all the options. Then you go into you graduate, then you go into houseman. When you are houseman, you will expose to all the major posting, and including other minor posting. You will, by that time, I feel like you should already decide where you want to go. It's more of internal medicine line, or is it a surgeon line, or is it other line, like for example public health, radiology, pathology line? You sort of like have an idea, because by the time that I go into houseman, I already get my mind. I already know that my personality is towards the internal medicine side. I know that I can't do surgeon. Then from that time, then I made decision that I want to go into internal medicine. Then when I become the MO in medical posting, medical department, I already know that I already start exploring which specialty that I want to go into. Okay, so I think now you keep your option open, but I think during your houseman time, you have to sort of like decide which direction already, which big direction already. By the end of your houseman, you really need to make your mindset. If you don't make your mindset, you can't proceed that easily, because you don't know what you want in your life. Then your journey to become a specialist or subspecialist will become much longer than 34 years old. Okay, then I think it will be a little bit difficult for your family life when you are still not really that settled yet lah. That's from my point of view. Other panels. Okay.
Prof. Yang, Fad, want to add to that?
Yes.
Prof. Yang, answer first.
Yes, I think I think what I would add more to what was mentioned by Prof. Kwan is, I would say that you need to some opportunities, some things that you prepare are general preparation that can help you enter. It's translational skills. So you need to start honing your skill as a team worker, get yourself involved in projects, get your start presenting, start to do poster presentation, yeah, and so on and so forth. If there is a research opportunity, start to join the research team, be in the writing committee. These are general translational skills. So skills of being able to do simple statistics, skills of numeracy skills, skills in talking, presenting, teamwork. Get all those. There are many courses you can take also. Webinars, collect all this evidence, attendance, collect this to show that you are very serious. So those are general skills that we want to see in a trainee, because we feel if you have these skills, you are trainable. You are trainable. So that's number one. Number two, the other more specific skills, there are many, but this one I think will cost you. Let's say if you want to take exam or you want to take a course in radiology, for example, you want to do exam radiology, that's going to cost you. To do that, you already must choose what you want to do. Unless you have so much money, you can take all different courses and then get to choose, because these costs. So I think it was mentioned, like some of the UK courses or UK exams, they are just exams. They don't come with the training. They just, you can just take the part 1 exam. So let's say you take the part 1 of radiology, which consists of medical physics and anatomy. And then when you apply for radiology, that's going to be a big plus point, because it shows you are really interested in radiology. Yeah. So I would say that would be the way I would just add on to what Prof. Kwan said. So general skills and then specific skills. Yeah.
But
Okay, having said that, actually the reality of real world are totally different from the theories. Okay, so I would wonder what year are you, who's asking the question just now?
Akmal.
Okay, so usually, if you want to know, medical students are so much interested on what they feel nice or good during their students' life, or if the lecturer is so nice, like Prof Yang so good, so suddenly I want to become a radiologist. Okay, but when you go to houseman, it's totally different. Okay, from opinion of my experience, I wanted to become a surgeon when I was a medical student, because I think, wow, surgeons, you know, all these vibes there. But when in a real life, as you are a houseman, you realize that you don't fit into this, unfortunately. Hence, actually, this goes along the way, because you have to identify yourself. You have to know yourself. Who are you? Introvert, extrovert? Do you like to see patient? Do you want to play with bloods? Are you a procedure? Do you have a good hands and things like that? Okay. Of course, I echo what Prof Yang said. If you really someone who have vision and you already determine that this is the way you want to go, you fill up yourself and to make fit into what do you want to do. So take all the courses, make a good CVs of yourself. So when you come and show to us all the CVs, obviously you become one of our best candidates to be in. Yeah, that's my opinions on it.
I just want to add, overall, what we're talking about, you see, when people ask you to do things, don't think, alamak, I've got to do this, I've got to do. These are actually opportunity to show yourself. Grab that opportunity. I mean, during my training, I had to do things like organizing family day, but that teaches you organization skill, right? So don't say no. Don't say no. Grab it. Do it. And then you learn. Because the specialized skill is specialized skill, but actually what's going to put you through and what's going to make you enjoy your specialty is actually the general, personal, and professional skills that you have. Okay?
Like EQ, things like that.
Yeah. Do not No,
Yeah.
nothing is a closed door and nothing is a closed window. Please. Unless people are asking you to do bad things, of course you're going to say no. I'm just saying, if it's positive, you must always try and see the positive aspect of work. People don't sometimes, I hope we can tell you, see the positive aspect of work. It will pay off.
Yeah.
Okay?
Yeah, correct. One more thing is for general, whatever that you want to do, don't stand behind. If got opportunity, stand in front. Show yourself to your specialist, to your subspecialist. Try to build up all the presentation skill. People can see you, know that you are motivated, you can work. Okay, all these will add point to your CVs. And when you submit for the interview, things like that, you will definitely need to put in the name of reference. Okay, so you have to really show yourself in front of your specialist for at least like 1 year period of time, so that your specialist know you. Then you put he or she as your referee. Then they will be able to comment on your performance. That all this will help when you try to get into the specialty training. Don't stand behind. Don't stand behind. Go in front.
Okay. I think I will add to one question then. So as a panelist for master candidates, do you think extension during housemanship training is a deterrent for you to choose a good sort of candidate?
Oh, no, not at all. I can just say not at all. Not at all. Even if you take longer in medical school, not at all. Not at all. And I'm not going to even expand on that answer. Not at all.
Okay.
Because there's many factors that someone actually need to be extended, so that confounding factors have to be factored in. So it's not a factor for us to actually choose you to become the candidate unless it's attitude problem. That's different level, yeah. Late does not mean you are good. There are people who are actually late, but they are better than people who actually come early.
Yeah. I will add some more. I thought I was not going to add, but I think if you are going to throw a stone to the heads of department, heads of service, hospital director, name the who's and who in medicine in the Malaysia, you are going to hit somebody who maybe have taken longer to medical school or taken longer in housemanship or taken longer in their training to be a specialist. This is part of healthcare training. It's competency. Competency, time is not a determining factor of how good you are or how competent you are. So don't, you'll be joining a fine bunch of people who's had to undergo all that difficulty, and we survive. We are okay, and we're doing well. Okay.
Okay, that's good to know. But I hope it's not sort of taken as a reason to extend your housemanship training.
No, of course not.
Okay. Any other questions from the participants? Please, you are allowed to talk actually, so please feel free to answer anything. Okay, another question. Okay, from Akmal. What are the differences between KKM and university hospital as trainees and specialists in terms of payment, career growth, workload, job scope, or any other relevant aspects? Okay. So I think he wanted to compare being a specialist in a university universities as well as the KKM hospital. Anybody wanted to answer that?
Kwan, you stay in MOH longer?
Okay, so maybe I start with the salary, the payment. I was quite long in KKM for before I joined MOHE. So when I joined, right, when I joined the MOHE, I give an example. So let's say at the time that I stopped my KKM service, right? KKM service. Let's say my salary is 2,000 per month. Let's say, okay, 2,000 per month. So when they offer you the job in university, right, it will never be lower than that 2,000 that you are getting. They will always be higher. So the same grade in the KKM and also the university, even though the title, the grade is the same, the amount of the payment that you receive is always higher, okay? So I think I start with answer the first question in terms of the payment. That is why I think that is in purpose, because they want to encourage people to join MOHE because a slightly higher pay lah. Slightly higher pay is given to encourage people to join MOHE.
Kwan, if I can ask about the career growth though, correct me if I'm wrong. If you want to be a JUSA-C in MOH, is there a limited post? Can you just confirm that for us? Is there a limited post for JUSA-C?
Yes, there is a limitation.
So the difference is that in university, when you enter, it comes with your own warrant. It is not dependent on other people filling the post. Yeah. So basically, when you talk about your promotion, it is based on whether you can fulfill the university's criteria for that promotion and go through all the processes. But what I'm saying is, I think in terms of career growth, in KKM, there is growth. I'm sure there's growth. It's just that the growth is dependent on how many posts are available for that particular post. Whereas, similarly in a university, if you want to be VK7, it's up to you. You work for it, and you will be given the post if the university feels that you deserve it. And this goes up to VK5, actually, even higher. So,
okay.
Yeah.
Dr. Yang, I thought in MOHE there is also a limit to the post of JUSA-C.
No.
Okay, let me, as a deputy director, I know all this. Okay, when you join as academician, means you are as a lecturer, your posts are flexible. So Akmal, VK means is almost similar to your JUSA in MOH. So VK 7, 6 and 5 are professorships lah. So it's a flexible post where it follows when you enter the academic world, which is you join the faculty. However, in hospital university as well, there is a service post where you take care of a hospital in the universities. This is equivalent to almost MOH service post, where the JUSA, they don't have VK because it's not an academic, they have JUSA. But this one is a limited post similar with MOH. Right? So academician has an extra salary because we have an extra teaching allowance, all those, but it comes with KPI of teaching. Yeah. So in services, they don't have KPI teaching, and only almost similar research you have to have research nowadays, yeah. And it almost become mirroring to each other now between MOH and MOHE, but a part of academic part KPI is not yang being strengthened in the service part. So these are both career growth are similar. If you want to go to such specialty, both can expand as whichever they are. But university, you will have a little bit more ways because we do research and all those things, because that is part of our KPI. Job scope similar. If you are a radiologist, you still have to do this. If you are a hematologist, you still have to do what hematologists like that in KKM. But with a little bit more, you have to take care of students. I hope I answer your questions.
So basically, if you join a university under MOHE and you become an academician, your warrant is for you.
Correct.
So you determine what you're going to do, what you're going to produce. You have all your KPI things. I feel the main difference is that both have career growth, but in MOHE, part of your career growth, a major part of it is not in your control. Whereas as an academician, it's actually in your control. Of course, you will complain, you will say all sorts of things, but in the end, it is in your control.
Just speaking my experience in MOH and MOHE lah. At the end, I choose MOHE because I feel that I have more flexibility. I can still see patient, I can still do the thing that I like, but I can do other things that I am interested to at the same time. Like, for example, research, things like that. And the time is more flexible for me. Okay.
In terms of job scope, I think in terms of job scope, I work with University of Malaya. We serve University of Malaya Medical Center. This is a hospital, it's the second largest, I think maybe third largest hospital in Malaysia. It has more than 1 million patients. So in terms of job scope, I think as a radiologist, it's probably similar to a very active hospital in Malaysia. Ministry of Health hospital. We are a teaching hospital. Yeah? But on top of that, we have to teach, we have to train, and I'm not saying MOH doesn't do that. I think MOH does that too. And we have to do research. But our teaching, as I said, it is not, I cannot say, today I don't feel like teaching, tomorrow I feel like teaching. No, I can't, because it's like part of the, I think Prof. Lashmi has put here, key performance indicator of my work. I have to teach, and I'm given an allowance to teach. So every day you are doing some kind of training. Yeah. So I would say job scope really and workload really depends on where you work. If you work in a busy hospital, then definitely your workload is going to be more, but it also gives you more satisfaction when you're doing it. And it really affords you the teamwork of working together. And you are able to probably impact more national level decision making, probably. Yeah.
Prof. Sujab, I think you can also become an administrator at the hospital level if you choose to be in MOHE. Your chances are a bit higher lah. That's all.
Yeah, correct.
Yeah.
Administrator.
The work if you are in MOHE, part of your KPI is to show administrative duties. Most of us choose like 10%, but it's still there. You have to show administrative duties, capabilities. Yeah. So don't say no if people ask you to organize Hari Keluarga. Don't say no. It's part of your organizational skills.
Hari Keluarga is actually a very good opportunity for you to get to know the key people, because when you are the organizer, so you get to you have the ability or the opportunity to communicate directly with whatever the key people in their disciplines actually. And I also wanted to add one more thing, which I think is quite important. If you work in universities, you stay put in one place, so you don't have to move from one place to the other. So if you're working with the Ministry of Health, chances are if you have completed your specialty training, you might be posted in other hospitals in other states, in which you have to relocate. You have to relocate your family, and if your wife is also as a doctor, maybe both of you have to work long distance, one in one state and the other is in a different state. But if you work in a university, then you stay put in that university until your retirement. So I think that's one factor that you can take into consideration when you when you make a decision about which specialty or which whether you want to work with MOH or whether you wanted to work with MOHE.
But that will exclude that cannot apply during your training time, lah,
Yeah,
your
yeah,
specialist training time.
that's only applicable after you have obtained your specialist degree.
Yeah.
Okay, but that can be quite important, you know.
Yes, yes, correct.
Yes.
Yep.
Yes.
All right. Okay. So I think now is 11:35. We have come to the end of our webinar session. Or if there is any burning question from the attendees, I can allow one more. If you have, but you have to ask or type now. Okay.
While waiting, if there's no one going to say anything, I just want to say thank you to, I think I too learned a lot from my fellow panelists, and it was really fun doing this with you. Thank you, Memes, and thank you, Dr. Saila.
All right. Okay, so there's no questions then. I'd like to take this opportunity to give our special thank you to all the speakers, Prof. Yang, Prof. Kwan, and Associate Professor Dr. Fadlina for spending your precious weekend with us, explaining to our future specialists on what are the pathways, what are the challenges, in whatever pathways that they choose. So I hope it has been beneficial to everyone who attended. And please also join us in the future series of MEMS webinar. I think that will be all. Thank you very much. Okay, host, do you want to add in anything else? Lakshmi?
Can I quickly just add?
Yes.
Thank you, Dr. Saila, and all the esteemed speakers, Prof. Yang, Prof. Kwan, Prof. Fadlina. I just want to quickly, on behalf of the committee organizing the Career Talk Pathway, I just want to share the subsequent 3 more seminars that we'll be having. Just going to quickly share. Okay, so I encourage all attendees, medical students and junior lecturer or junior medical officer, to take notes of subsequent talks we will be having. So if you notice, we have had talks on family medicine and GP. That was done last month, and now we are having today career pathway in medicine-based specialties today, and we'll be having 3 more talks after this. The next one will be on November 18th on surgery-based specialties, and followed by lab-based education and pre or paraclinical specialties on December 9th. And lastly, we'll be having alternative career pathway, which is beyond medicine for those who have successfully established themselves beyond medical practice. So we have these 5 altogether pathways. So I encourage all attendees to take note of the dates, and invite, please promote to all your friends and colleagues as well. Okay, thank you.
Okay. I think that will be all. Thank you, everyone.
Thank you. All the best.
Bye-bye.
Thank you, speakers. Fantastic job. Well done.
Thank you. Thank you.
Bye.
Bye.
Thank you so much.
Thank you for
Bye.
Bye.